So you're getting a hip replacement. I'm 3 weeks into my hip replacement, and I'm going to give you a hip replacement from A to Z. So I'll try to make it pretty quick. So about 3 weeks before the operation, you are going to the hospital. You're going for a class. It's about an hour long. They're going to tell you what you need for home, how you get in and out, walk around the house. A couple of things you're going to need: a raised toilet seat, 2, a walker, 3, a cane, 4, a grabber, one that grabs on the end, and 5, to put your shoes on. I just bought a 3-foot wooden ruler. You can use it as a shoehorn. Those are the 5 things you need. You could probably rent the walker because they're probably like over $100. The raised toilet seat, I had to buy it. That was $65 from Walgreens. So about a week before the operation, you got to go to your hospital, where they might do it off-site, where they're going to do all your vitals, your EKG, take your blood, boom, 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 do everything. Go over your medication, what you should be off the medication and beyond. So my surgery was 8 o'clock on a Monday morning. I reported at 8. Went pretty quick. They put you in a room. Let me just go back a little bit. 3 days before you go to the hospital, you got to take a bacterial sponge bath to get rid of any bacteria that don't want you getting an infection. So I had to do it Saturday morning, Sunday morning, and Monday morning. So when you get to the hospital, they put you in a room. You got to take off all your clothes, and they're going to give you a bacterial, not the sponge this time, just wipes. You got to wipe your whole body down from your neck to your feet again. Then they gave me some Celebrex and some Tylenol. About 15 minutes, they came in again, and I got an epidural. I never had one. Most people haven't, but it didn't really hurt. They go through your back. Took about maybe 10 seconds. And what that does is going to numb you from your waist down to your feet. So they gave me that epidural in about 15 minutes, started to work. Got me into the operating room. I was maybe in there, maybe 30 seconds. The anesthesia mask went on, I was out. Next thing I knew, I woke up and I was in another little area where I had a nurse at the end of the bed running my vitals, and she wanted to know when I could start feeling my legs and my feet. So it took about 2 hours. I started getting feeling back. Once I got all my feeling back, at this point, there's no pain because you're numb from the waist down. So you think, wow, I had the operation, there's no pain, but it's gonna come. So that wore off about 2 hours, brought me to another room. I was only in there maybe 15 minutes, and they wanted you walking. And a therapist came in. They had a walker. We walked down the hallway and back, boom, boom, boom. Then I was in that room for about another 2 hours. They gave me a couple of IVs, I guess some fluids. And at 6 o'clock, I was going home. So then they called in all the medications. So we picked up the medications on the way home. There was 7 prescriptions. Don't get alarmed. 1 was Tylenol. 2 was an aspirin. 3 was Celebrex. 4 was a muscle relaxer. 5 was the painkiller. 6 was something for constipation. And I forget the other one. Maybe there was a 6. Painkillers, they gave me 5 milligrams. You take 2 of them. The first day was the worst coming home. That was the worst pain. But as long as you're taking 2 of them, you're taking at least 10 milligrams every 4 hours, you're good. And one thing I got to tell you, you got to keep track of these medications. You're taking so many, whether it's Tylenol, some you take in once a day, some you're taking twice a day, some you're taking 3 times a day, and you're gonna get confused. You're gonna forget what did I take, what I didn't take. You gotta have a piece of paper, write them all down, write the times you gotta take it, and then cross them out. Most of the medications were just for 10 days, except the Celebrex and the aspirin, and the other pill, I forget the name of it, is it goes with the aspirin so you don't get an ulcer. And those are for 30 days. So I'm still on those 3, and those will be over in probably in about 15 days. I'm 23 days in today. And the improvements go by, I'd say the first week, I was on a walker. After the first week, about after 7 or 8 days, I went to a cane. And I'm not sure how everybody's insurance works, but the physical therapy came to my house 3 days a week. I was approved for 10 visits, so they came to my house, which was great. There's no co-pays or nothing. They would come doing some stretching exercises, not crazy stuff, just they want you walking. That's the biggest thing. Walking is probably one of the biggest things. Toe raises, all them, sidestepping. They want you walking. I would walk down my driveway 3 times a day and then come back. So after about 15 days, 16 days in or 17 days, I didn't actually need the cane anymore inside the house. So I would just walk around, and I have stairs in my house going up and down the stairs. And then just about 4 days ago, I had no cane at all. So when I even go outside, I don't need it. The funny thing about the hip was my left hip. So it feels like when all the pain goes away after pain doesn't really last longer than 7 days, I would say at the most. And slowly every day it gets a little better. It feels like you have like a big wallet in your pocket in the back. That's the feeling of the hip. And it's gonna be a little swollen. Mine's not as swollen as everybody else, but it's still swollen, you could tell. That should last probably, they say, up to 3 months. It could last up to 6 months. But I think in about another week or 2, I'm gonna be walking so much better. Right now I can still do walking, but you're not gonna do any crazy stuff. Just going over just to finish up a little bit. Like I said, I think I'm in my 24th day now. It's gonna get better. If you're just starting or you didn't even have it yet, it was an experience. I don't know if I want to go through it again. Hopefully my other hip. What happens is when you've got a bad hip, you favor the other hip. So most people who get one hip eventually get a second hip done. And that's when my doctor said between 3 and 5 years, I'm probably going to need the other hip done. So if you get in pain, have it done. Don't get these cortisone shots. A lot of these doctors want to give you a cortisone, or the patient's afraid. All the cortisone shot does is prolongs your surgery. And it's going to get worse. You're going to get the shot. I never got one, but even if you keep on getting the shots, you can't have the surgery until you're off the cortisone for, I think it's 5 months, because of they say it can give you an infection. So the big thing with the surgery is they was concerned about infection. Mine went good. And the other thing you're gonna get a fever. So the first day you get home, probably 3 days I had a fever, low grade, about 100. They only get concerned if you go over 101, and it stays there for a couple of days, because that's a sign of an infection. But you're gonna feel like you have like the flu, like the first 3, 4, 5 days. You're gonna be laying down. That's the thing too. Even though you have to walk a lot, I lay down a lot because it's very uncomfortable to sit in a chair. You're gonna notice it doesn't feel right. And they don't want your knees above your waist. So that's another thing. I bought a pillow. It's a 5-inch thick cushion that went on the chairs, and I used that the first 2 weeks. But laying down, you're gonna notice, like I had a couch that was nice and high that I could lay down there, and that made it a lot easier. It was very hard I didn't start sitting into a chair probably till about 5 days ago, because it's very uncomfortable. But that's about it. If anybody has any questions, you can let me know in the comments below. And good luck with yours.